again, why I can't swallow estrogen, it makes more estrone, it increases CRP, increases clotting factors, increases SHBG, can increase liver enzymes. In Europe, they use oral estriol, and the doses are anywhere between 2 milligrams and 8 milligrams. And the thing about estriol, it's really good for the lining of the vagina, and it doesn't seem to stimulate the lining of the uterus or obviously the breasts the same way. But again, it's a very weak estrogen, and it can compete and block the estradiol. And also oral estrogen can increase fat deposition and also increase the incidence of having gallstones. So in terms of bioidentical hormones, so we have basically the compounded ones that we can make at a compounding pharmacy. And basically we can make anything and everything we want. So you could, most often practitioners are using Bias, which is a combination of estriol and estradiol. And basically, originally it was mostly 80-20. A lot of practitioners are going to 50-50, but really you can play with whatever the proportion is. And just the one thing to know is that the estrogen receptor requires a dimer, meaning they need 2 estrogen molecules. So if I have a lot of estriol around and only a little bit of estradiol, what's going to hit the receptor more often? 2 estriols, maybe 1 estriol and 1 estradiol, but not often those 2 estradiol molecules. So if our thing is for hot flashes, both of those may work. For bone, for brain, for cardiovascular prevention of diabetes, it's that estriol molecule needing to be hit. So basically, again, how can we give the Bias? So you can give it transdermally or transvaginally. The dose range, so again, I'm a low prescribing physician, so I will, depending on the scenario, give different doses. So the range is 0.05 to 2 milligrams, but I'll tell you that, so a perimenopausal woman who I see high estrogen blood results, but is quite symptomatic, I'm going to start with a piss in the wind dose. And the reason I want to do that is I want to, kind of like a homeopathic, like if I give a little bit, it might just turn off the system so it's not pushing so hard to create that high estrogen, and it seems to work. So I'll give them that 0.05 or 0.1 milligram. But if someone's highly symptomatic, then I'm going to give them a higher dose, and I usually will start at 0.4 twice a day, and maybe my max dose is 0.8 twice a day. Why twice a day? I think it was based on me speaking to one of the labs and sort of saying estradiol doesn't seem to last around as long, so maybe BID doses is better. And again, we're giving a cream. I don't have any studies to show me the pharmacokinetics to say this is the peak or trough. So it's trial and error. And I think for me also when I started doing compounded, it was frustrating because not one size fits all, and nobody had an exact protocol to show me. And unfortunately, I'm going to say it's the same thing for you guys. It's trial and error, figure out what works for your patient population. There are many practitioners who are using 1.25, 2 point something, and higher. Just remember, the birth control pill originally came out at a 50 microgram 50 microgram dose. So it was a high dose of estrogen with a high dose progestin. Then we came out with the 35 microgram, lower dose, lower progesterone. You can balance a woman's hormones at any of those levels. The question is, where do you want that patient to be? I want to give them as much benefit as I can with preventing any side effects. Okay, estriol. So estriol is usually given vaginally. Back to the Bias. The little trick that I like with Bias is I put it on my face. Helps with wrinkles. Okay, estriol. So estriol is most often, if you're using straight estradiol, we're going to put it in the vagina. Estriol is actually widely used for urogenital atrophy outside of North America. In fact, Wyeth makes it. And Wyeth was the one who was blocking it coming to North America, or trying to have compounding pharmacists not be able to use it. It's funny, it's okay for them to use it, but not okay for somebody else to use it. And so in there has been studies on 8 milligrams of estriol for MS, which showed less plaque progression. So again, I told you estriol is great for urogenital, less stimulating on the uterus and breasts. The one caution is, so when you put it in the vagina, that the absorption might be higher and you actually can get a lot of systemic systemic effect. Again, speaking to your compounding pharmacy, find out what base they want to put it in. So if you're trying to help just the vagina, you want to keep it there. So you might want to use a base that's more likely to stay there versus Versa that is going to be absorbed and go systemic. Okay, so pharmaceutical grade estrogens, so that you can buy at any pharmacy. So transdermal, we have the patch. So one of the companies is Estradot, and the dosing comes between 25 micrograms and 100 micrograms. So depending on how symptomatic, now you guys are allowed to prescribe patches? Because it's transdermal, yes, no? Anybody knows? Okay. I'll give you the information anyways. So basically, with the patch, if someone's very symptomatic, I'm going to go on the higher end. So I'm going to go 75 to 100, or if they're very young. So if they had premature ovarian failure and they're 35 to 40, 45, I want to give them more estrogen. I want to maintain their bones, and then as they get older, I might start tapering. So I'm going to get that patient symptom-free and try to do it sooner than later. And then with time, I'll try to bring them down to the 50 microgram, 37.5 microgram patch. Estrogel, it's 1 to 2 pumps. Conventional medicine uses it all the time. I personally don't like it. I find people are more symptomatic, that the gel, the absorption, something that they have more hot flashes on it because I think it runs out. Digivel is a newer product, and I love it. It comes in a little pouch, and so the nice thing is the price of, it comes in 3 doses, 0.25, 0.5, and 1 milligram. And basically the price is exactly the same whatever dose you have. So the nice thing is you can give them the middle of the road dose, the 0.5, which I would say 90% of patients become symptom-free if they have hot flashes within the month. But if they find it's too much, like they're getting a lot of breast tenderness or headaches or bloating, you just empty half the package. So, and I say, if you throw out that package, you didn't waste any money. And then oral estrogen is estrase, which is bioidentical estrogen, but it's oral, so again, I don't use it. Vaginal estrogens, again, just for your general health, is Vagifem, so it's 10 micrograms. You put it in the vagina nightly for 14 nights, and then it's twice a week thereafter. They say if you use that over 1 year, it's equivalent to, I think, 2 milligrams, which is equivalent to 1 day of a woman's cycle. So you can really rest assured that patient, like even if they have, strong family history of breast cancer, or they have breast cancer and you've tried everything else and there's nothing else for them to use, you still can use Vagifem.